companies. So when we first got involved in digital X-ray way back, we were the people to bring Schick and bring DEXIS and bring all these companies into the dental marketplace. And, we really worked with a lot of progressive dentists at that time. And, there's this whole sequence of events that happens in terms of the psychology of a patient coming through your practice, and how do they make decisions, and what impacts the decision making process, and why is case acceptance nowadays so low in compared to the past, and what is the changes in the society and the information. And so this is where imaging has become really, really important in the day-to-day practice, and we designed the software around this to try to simplify the acquisition, the presentation of images, and of course the enrollment for treatment. So we'll review that today a little bit, okay? So let me just get into sharing the screen. Hold on. Okay, so are you seeing the desktop?
Yep.
Okay, perfect. Yep. Okay, so normally the way that these softwares work is they're bridged with your practice management, and in your practice management, there'll be like an icon, a button that you'll kick into and you'll launch, and it basically will launch this page. And on this page, you're going to see the patient information here in the middle. So in this case here, it's Dr. Tooth Hurdy and Robert Beauchamp as the patients, kind of thing. Okay, so it's connecting the two databases, so you don't have to worry, you don't have to enter in all kinds of new patients. It's basically going to be linked at all times. This is how all imaging software works. And I really don't care if it's seamless, companies that say it's seamless, it's all linked behind the scenes, okay? When you look at the basic layout of the screen, you have what they call viewports at the top, which are your areas that you can put multiple images up side by side, and you can then blow them up full screen and you can look at them and see them simultaneously. In the bottom middle here, we have what we call our mount area, where we have different biological mounts based on the medium or the multimedia that you're using in your practice. And this is also something that is customizable based on your needs. So I have a doctor up here that got into Botox. So he wanted a whole layout for Botox pictures that he takes before and after. And this is all customizable. So, and I'll show you kind of what I have here in respect to my demonstration. But in your practice, you can develop as many mounts as you'd like, and you can set them up the way you'd like as well, based on the images you're taking.
Perfect.
You have a button toolbar here at the bottom left. Also, that is where you're going to go and access all the tools and the apps that you have within the software. And then on the right here, I've put my educational library, which I'll get into and discuss a little bit further. And again, this whole desktop is something that you can customize also. And this is usually part of a more advanced training later on. But just for example, I'll show you, there's one icon here that if you click on it, any icon with these diagonal lines on the bottom right, if you left mouse click and hold, it'll give you multiple options within that button. And so you have 5 different desktops that you can program within the software. So when you click on, let's say we click on number 1, I've set this up for an office that did 4 bite wings in a pan. And I was playing with it before, showing people how you can move stuff around. So if you wanted this somewhere else, you could move it somewhere else, and you can design your desktop to be whatever you'd like it to be. So I had 4 bite wings and then 1 big pan but down here in the corner. So I'm just showing a little bit of what you're able to do once you get a little more familiar with the product. When it comes to just taking x-rays, we really tried to make it as easy and simple as possible to acquire x-rays. So one, we've created these special buttons that can be created for the specific type of sensor you're using. And this is where, if you are using a multitude of different sensors, which is what's going to happen over time, you can have your ScanX, your Kodak, your Schick, your DEXIS, everything all within the same toolbar. So when you're in the op, you just launch whatever sensor you want to use, and the team makes it easy for the team to just choose which software and sensor, which sensor you're going to be taking x-rays with in that room. Okay. For demonstration purposes, because I don't have a sensor in an x-ray head, I just have a demonstration button that I click on to show you the image acquisition area. But this is where you can now acquire images automatically within the system. So most systems do this. You know, how we differ a little bit is we have a very easy way for you to organize the images. You can have a whole bunch of different sequences here if you want, where it will be followed by tooth number, and the big numbers are really the sequence that it will follow numerically. So let's say, I don't know, you wanted to create your own. So we have add a record or sequence. Let's say, I don't know, Kathy likes to do it one way. We can then put in any type of a name. It says, please put in your sequence and hit escape on the keyboard. So if Kathy likes to start here, and then she likes to do this one and this one and then this one, and then finish with these bite wings, and then does, I don't know, 2 periapicals, done. So now it's programmed and the sequence will be followed, and the computer will automate everything, okay? So in this sequence, the computer, you don't have to touch the keyboard or the mouse or anything again. How it works is the staff will put the sensor in the mouth. Once they're in the screen, they'll go out of the room, they'll hit the x-ray head, they'll come back in, they just move the sensor forward. They go out of the room, they hit the x-ray head, they come back in, they flip it on the other side, and they'll do the bite wings, or whatever way you want it to do it. And it's basically automated. So you can do an FMX in about 5 minutes. So it kind of saves a lot of time. It allows them to quickly get it in there. Do you guys do FMX, or are you doing 4 bite wings? What do you do?
I do both. Right now we're doing FMX with the pan. But now, is this smart enough that if we set up different mounts, like sometimes we're doing like endo or whatnot, depending on which side of the mouth, to flip it, we're always having to manually flip it. Can we set up different sequences so one way we know if we're in upper right or lower left, it's going to be like one way, and I'm assuming we can program it that way, so we don't have to continually be flipping our mounts.
Yeah, what we've done is a lot of the softwares initially that we dealt with had like individual exams that started to be taken by date. And this really wasn't a very smart way to do things, in our opinion. And this is one of the things that actually Dexys developed, and was quite progressive in their thought, is that they had one mount that kind of was chronologically placed, and then everything behind it is chronologically in order. So you have one mount here, but you can override. So let's say you do have somebody come in anterior or upper right, upper left, whatever, and you're doing an endo, you can just click right on the tooth you want to take, and you can tell the computer, don't advance in the sequence. And when you click on that area in the mouth, it's already programmed to be oriented the right way. So when you're going to take the shots, you'll just, for the sake of the demo, I'll just click. Now it's taking a bite wing, obviously, but it would be a PA that would be placed there. And you would automatically be able to take multiple shots, and it would save it in that tooth number automatically, chronologically. So if you did, your pre, and then your working length, and then your post, it would all be taken there, and they would all be one on top of the other. And then you can easily just click on it and hold it, and you can see them chronologically tile out. And anytime you want to view them, you can just double click and it will show it. And then you can even use filters in the acquisition if you wanted to really see, well, did we get that information we wanted to see? Did we get that apices? Did we see the abscess? And this is where you can tweak the image, and you can apply it all within the acquisition mode, just to ensure that you're getting the information that you need and you're showing that detail. So they don't have to go back, go take another image, whatever. Now they can do it on the fly in order to be the most efficient and save a lot of time.
That's
so
nice.
So yeah, so you can really set it up to, when you're taking x-rays, you can either follow the sequence, you can choose a specific tooth, and then I'll show you after, once we get out, how you now have this historical viewing ability. So go ahead, you had a question, sorry?
I think you'll probably get to it on that. I did have one other question on the sensor setups, because I know you're talking about how you can use different sensors for different companies, and that's fantastic. What about if I have 2 sensors from the same company, but I have one operatory. I've got an X-ray head, and the sensor's connected to the head on one side on the pass-through, and on the other side I got the same thing with the same type of sensor. They're on different sides. They're routed through the network differently. Currently, I'm only able to use one of them. I can't switch between them on the fly because it screws up the software. But it sounds like this software would be smart enough that we could basically have one button for one sensor and one button for the other, and it would know which one to grab it from.
Correct. We could probably program two separate buttons if it couldn't work simultaneously. Normally, when you have the same family, you might have a number one, number two size difference, and that's where you launch the software actually automatically will pick up the size before we even had to choose, like, okay, I'm using my number one now, I'm using my number two. Now the computer automatically sets it up and we can register the sensor in the system. So I believe, I don't want to say 100%, but I do believe that we could solve that issue either through the way we register the sensor now, or by having an additional button if in worst case we had to designate a separate system to work separately. Yeah,
I think it was an IP address issue. So I as far as knowing where to route it to, but but we'll get into that later. I'll let you keep going.
Yeah, we'll be able to work out all those little kinks and things over time, but I'm pretty confident that we could deal with that.
Sure.
Okay. Yeah. So what's nice with the acquisition is that I'll just exit out and I'll delete all. So when you do go in, just to show you again, when you are at the beginning of the acquisition, just in case you wanted to see, if there is a screw up, it blows it up full screen so that the staff, when they're taking an x-ray from 20, 30, or whatever, 15 feet away, they can at least assess if there is a retake need right away. So when they come back in the room, they can really quickly reposition, or if they miss the apices or whatever, they can make sure that they get it. So it has this feature that blows it up full screen. And let's say they take the shot and then they realize, oh crap, I took the wrong x-ray in the wrong box or whatever. You just click on the x-ray, you can drag it and drop it in the right box. You can click on it, and if you right mouse click, you can change the orientation. So you can easily, in the mix, on the fly, automatically just fix things on the go so that you're not fixing things after, which sometimes are a pain in the butt. So yes, it makes it that much easier for the staff, and they don't panic and they don't worry when these things happen. And then it's just following the sequence, or like I said, you can override the sequence at any time. And then once you exit out, and I'll delete, I won't save them all. You'd normally save them all. You come back and your FMX would be here. And then anywhere that you would see like a plus sign. So let's go to my other x-rays. So that's with vertical bite wing if you have them. But anytime you'd have like a plus sign next to it, it means that there's other x-rays underneath. So there's two ways you can access them. It's either through the arrows, where if you put your mouse on the arrow, it'll tell you what it is when you click on it. So this is 6 of 6. So if you click the other way, 5 of 6, 4 of 6. But another way that we like to do it is if you click on it is you just hold your left mouse button for a second. It tiles them all out by date. So now I can easily see, okay, this was 6 months ago. This was 12 months ago. This was 18 months ago. So then you just double click, and you get them all up side by side. And now you can view your last, 18 months, 24 months of the bite wing history to see how things are progressively getting worse or what have you. And that's kind of how we have this historical quick view, which is sort of, Dennis loved this feature. When you're looking at the x-rays, it's the most recent x-rays that you see. And then of course you have the ability to extract information from the database of images, where you can choose, between specific dates if you'd like. You can choose outside specific dates, or every single time you've taken x-rays, there's a date stamp. So you can say, I just want to see x-rays from these 2 dates. You click on the check mark. It'll show you the x-rays taken on that date, and the bar goes pink on you to let you know you're not looking at all the images. You're just looking at a segmented extraction of the images. When you go back to the loop, it automatically defaults to no filter. So you just hit the check mark and then you're back to all the images. So if you're really looking for specifics, you could either do it like this way, kind of just tile out and kind of, put your mouse and see the dates of the images, or you can extract that other way if you really wanted to see a specific exam date. But this way it saves you from having a multitude of exams saved by date, and you got to go searching and cycling through all these exams and then get one exam up against another exam, and then you're cross-referencing. This is all much sleeker and all in one spot. And we've done this for every piece of multimedia in your practice. So here is your your drawer of the different types of mounts that you have. Now I have a lot of mounts here because I'm obviously demonstrating to a lot of different specialists, but most offices will have 3 or 4. You'll have like your intraoral camera, your x-rays, your pan, you know, and then maybe a digital handheld SLR,
Yeah.
or ortho if you're getting into that, Invisalign, whatever. So this is where we have the intraoral camera, where we've also set up a full mouth series. So we have from, you know, the 8 to the 1, and then the, you know, the 16 to the 32, etc. This is set up right now for the Canadian numbering system, but it would be the American numbering system for you. And this allows you now, when your staff uses the intraoral camera, this is where it kind of depends a little bit on the camera you use, but the camera that we have has some buttons on it, and we can program these buttons. So there's also a foot pedal that you can invest in, and this really saves your staff a huge amount of time. Is when you go to launch the intraoral camera, what happens is that the camera will automatically start on the first quadrant. So what we train the office to do is you do what they call this co-discovery, co-diagnosis.
Yep.
And you do a tour of the mouth with the patient. You kind of start by doing, you do like a starting on the first quad, and then you go around to the second quad, down to the third, and then to the fourth. And then when they notice that there's some concerns that they're going to want to, you know, take pictures of, you're going to go in the mouth and you're going to take those shots. So the button on my camera allows me to advance through the tooth numbers automatically. So if I see, okay, there's something on that, you know, 5th premolar, and I want to take some shots on it, I can then go in and take pictures.
This is the P31 that you have, something like that.
No, this is a camera I have in my house that I've had for a while. This is not the camera that they have, but I've tested the camera that they have, and it does work with this system. So
Yeah, I know it's got a mouse integrated with it. Now, you think a foot pedal speeds it up to a degree?
not really. I mean, I you know, like most dentists, they have like 18 foot pedals that they hate on the floor, and then the cables and all that crap. The hand, if it's a well-designed push button type camera, it'll be quicker through this, I think. But again, it's also subjective. It depends on the end user. Some people might like the foot pedal better. It's a USB. It's easy. It's an easy connection. Or you can use the buttons on the camera. From our experience, the buttons on the camera tend to be favored, but you know, you have the 2 options.
Sure.
And then, you know, you take a couple of shots, and you can take your distal, your buccal, your, you know, your kind of occlusal. You can get those images. You can get the macro shots that you need to communicate what you need to communicate, and then you continue on and you take, you know, some more shots. And then you continue on. So what this does is it allows the staff to quickly and easily acquire the images underneath the tooth number, and there's no post-acquisition administration, typing, dragging onto the tooth pictures, and trying to figure out what tooth that was after they've taken 30 pictures.
Yes.
They don't remember what tooth it is, and then they have to go back in the mouth. And so there's a whole bunch of time wasted there. So with this system, it saves a valuable amount of time. And when it comes to using images in dentistry, I mean, we all know that pictures, you know, speak 1,000 words, and you know, it really helps to enroll people to see the need for treatment and stuff. The big challenge is, where do you get the time to do all this? And this is where you want to get a software that allows you to get images in quickly, easily, and that's where this type of programmation allows you to do that. So by using sensors and being able to do an FMX in, you know, 5 to 7 minutes, it gives you that time now that you can use to get that camera to get those pictures in. And then when you get those pictures in, it allows you now to easily show patients, you know, be it an emergency patient, a recall patient, whatever the situation, you know, you can get the images up side by side, which allows you to easily and quickly show them some of the concerns. So you go here, then you go to your intraoral camera, you're going to get the exact same tooth number up next to it. You're going to double click that. You might even want to give them a little bit more of a global view of things. So you might go into your pans, And then you might get a pan up there, and then you might even, you know, have those SLR photos that you want to have maybe if you take them. And again, we've automated the acquisition of those type of pictures, and then you can get those, you know, into the picture. So you can say, well, what we're talking about is, you can see here, Mrs. Smith, we have some, you know, decay here that we could see, this dark area. We also have something up here and something here. In the intro camera, you know, let me just blow that up for you, Mrs. Smith. Double click. Let me darken this a little bit up with the mouse, just a little left mouse click, and you drag it to the left. You can really see there's a fracture here on the back of your tooth, and we have like a dark shadow here. Do you see that? So there's something going on under here. There might be something getting in here, and we're gonna have to maybe treat this tooth. Just so you understand, Mrs. Smith, it's on this side of your jawline here. It's over here. It's this one that we're talking about here on the back of your mouth. Do you feel that with your tongue? Okay, good. So now we're gonna go in and we're gonna say, okay, well, let's go to my treatment library, and I'm gonna show you kind of what your options are for treatment. So, you know, here's my composites, or here's my veneers, or here's my crowns, or here's my bridges, or here's my cosmetics, or so this is where you have this library that you can create of your own work. So you just double click, and then you can use the arrows on the keyboard and say, well, this is what I'm recommending for you today, Mrs. Smith. You know, it'll be this, you know, so this is a situation with Dr. You know, this is Miss whatever, John, and him, after we did this case of veneers on him, it changed his life. Here's Cindy, we grinded down her teeth, did a little bit of a composite restoration. Here's, you know, Lisa, and we did a whole set of crowns on her, changed her life. She's now a model. This was Mrs. Smith, you know, whatever, smoker. We ended up doing her teeth, and now she feels so much more confident, whatever. But this is where you can start to create your library of whatever you want to communicate to the patient, be it advanced periodontal disease, be it, you know, your bridges, your crowns, your implants, your whitening, your whatever you want to start to show and educate. If you want to show the steps of a crown, if you want to show anything, you know, that you might want to educate that you just hate saying 50,000 times a day, you can use images here, and you can create this library, which is, I think, has a huge, powerful impact. And it's very simple for you to do. All you do is, you know, right mouse click on global, add a folder, you know, you type in whatever you want to type in, you click OK, it's added to the list. If you just did this beautiful before and after, you just take that before, you pop it in, you take an after, and you pop it in, and the software will automatically remove the patient information. And now when you click there, you have the images that you can now show. And from every single patient, when you're in there, when you click on the global library, all of those images are always at your disposal, and you can easily enroll them and show them the quality of work you do, show them other patients that have accepted these treatments, show them, you know, the options, plan A, plan B. I even had a really interesting doctor who was showing compromised treatments. So the guy did a large MOD, very thin cusp remaining, told the guy, look, you know, we might do this today, but, you know, you go and eat some popcorn next week and that sucker pops off, we're going to have to do a crown anyway. Let me show you this one picture of that situation. And he shows these cusp fractures that, you know, and this is, I'm giving you both sides of the coin here. So yeah, we could do this now. It might be a little less now, but later you might end up doing this anyway. So my recommendation is we do it now the first time the right way, is to avoid the additional costs. So images will, you know, it's again, trust with proof, backs up what you're saying, and very easy for you to start to utilize this in a systematic, easy way. So they'll see the need for treatment. They'll understand by seeing both internal, external information, and then you start to show them the work and the options. And then lastly, if you have the advanced version of the software, there's a beautiful report generating aspect to the software, where if you go into the icon with the report writer, which is not here. Why is it not here? Hold on. Let me just activate that. Maybe I deactivated in the last demo. Oh no, it's there. Am I blind? Oh, it's here. Sorry, I've been I'm blind. Sorry, it's the second icon. I moved it. I normally have it down here. Okay, so you just launched the report writer. So now there's a set of reports that we include in the software. They're kind of templates, but again, you will create your own templates or you'll modify these based on your own wording and needs. But here's like a typical cosmetic enrollment report, and you just go to the patient's images. Hold on. How do I get this out of here? No. No. Yeah, there we go. So you access the patient images just by clicking on the image mount here. It'll open up the images, and then there you can start to place the images that you want to put into a professional report. And then you can click and say, well, here we talked to Mr. Robert Beauchamp today. Here's the before and after crown lengthening and bleaching treatment that we're recommending. You just click on the email. It will launch an email now with that report attached, and you can just email it off to him. Or you can email off things to referring dentists or to specialists or to whatever you'd like to do in terms of generating that report. And you have access to all of your images here. So your x-rays, if you want to put an x-ray in, if it's an insurance report you want to generate, you can choose the x-rays here. You can also choose the intraoral camera images and have them side by side. So sometimes, you know, the insurance company won't see what they need to see. So you can add that picture of the tooth by tooth number, and they can see the fracture and they can see the need for treatment and stuff like that. So you have a nice, you know, professional report generating software that allows you to create these professional pieces that they can bring home to their loved ones to discuss the treatment plan. And then we even have the cosmetic simulation. So when you have somebody that has something like this, and maybe that new patient questionnaire has that question about you, if there was a magic wand and you can wave it, you know, what would you do to your teeth, or how would you change your smile, or would you change anything in your smile? And we all know that everybody wants whiter teeth or straighter teeth, or so you have the staff that can now take somebody like this, and if you're using like an SLR camera, which is the best, you'll get really high quality images, and then we can go to our whitening simulation or cosmetic simulation, and we can go in, and the staff can, within 2-3 minutes, can kind of show what that person could look like if we did do maybe 2 crowns or 2 veneers, or even a, you know, composite diastema closure. And then we can even do a little crown lengthening on the lower half of the tooth to bring it down to the same incisal length. And then we can even do a little gum recontour here, you know, around there. We could lift it up to even out the gums and make it look a little more aesthetically pleasing. And then we could go to the whiten tab, and we can open up a nice box around the white teeth, and then it will choose automatically the white pixels. And then we just go whiten a little bit, and then we bring down the yellow, bring up the blue, finish, and you do a before and after. And then you can tell them, this is what we could do for you, Mrs. Smith. This is how we can make you look. You know, today, if we just do a little cosmetic on the anterior, or we do a whitening, we could show you, you know, how much nicer your teeth will look, and you'll get rid of that gap. And this is where you'll have a C that'll be stamped on this cosmetic simulation, so you know that you've presented them with this type of a treatment. You could follow up in the future. The staff can see this saved in their file. So this is where we would save it in the patient's file. You would name it, you know, cosmetic simulation, whatever, and you could save it in the patient's file and then use it later. So you go back, and this is where in the SLR setup, this is where you would save it here, and then that way they would know, okay, I have a image in here with a C on it. Now I know that we've done something for her the next time they come in, and we can revisit it. Did you think about that treatment? Would you like to move forward with that? Are you using SLR cameras at all, handhelds, or are you just using intraoral?
Yes, I do have an SLR. And I was going to talk to you when you kind of got done with your presentation about kind of best ways to import that. If there's automated ways. Right now I'm just got a file system. I'm kind of importing them manually, but I was wanting to do some type of, they used to have what's called iFi. I have a bunch of those cards where you automatically digitally puts it, connects it directly to the computer without having to plug it in. And
Yeah.
I don't know. I'll see if there's any way that there's we just manually import them, or is there any way to actually acquire it directly into the software. It's kind of, with SLR, it's a little tough.
Yeah. With the Polaroid software, we have the ability to interface with the Wi-Fi communication of these digital SLRs as well. It is a little bit of a delayed kind of reaction the way it gets in. Most offices like to use they like to just create from a protocol point of view, when you're looking at the day in, day out routine. The way that we worked with this, we kind of worked with LVI at the time, and then there was another group here, the Fortune practice. But the way it works with the software is there's an import icon. So when you click on this import icon, so what we did is that normally in the practice, we'll dedicate like one area, one computer, one station to being the download kind of station. And the quickest way and the easiest way to do this is to have a card reader, and you remove the card from the camera and you plug it in. And then when you hit this download icon, the software automatically will always go back to the card reader. So it automatically goes and it will open up what's on the card, okay? And the way we designed this is we actually told the software to delete the camera images off of the card automatically once downloaded. So it creates this sequence, because what happens is after a while you get 80,000 pictures on this card, and then the staff opens it and they can't find the images, or they don't know where the images start and stop for the next patient, and it just becomes confusing as heck. So we created this system where you can create again a mount based on your needs. We have here programmed different exams of different numbers of pictures. So again, it depends, and you can create your own here. We have some defaults, but you can create your own. So we had, based on taking 6 pictures or 8 pictures, it really depends on how many shots you're taking. LVI had up to 20 pictures that they were taking. So it was a little bit, it was a lot, but I mean, most I think stick around 10, but they'll do like the full face, full smile, and then with retraction, in occlusion, out of occlusion, and then buckle, and then you do the arches, or you can do, with an intro camera, you do the linguals if you just want to get the full anatomy kind of documented on file. But once you've taken these pictures, there's the sequence you take them in, and then you'll program that sequence. And then basically, when the staff takes those pictures, takes out the card, plugs it in the card reader, hits the import, it opens up these images. All the staff does is select all, import and exit, and it just places them all anatomically in the right position. Everything's laid out automatically. They take the card out of the card reader. It's now blank. They put it back in the camera, and they're ready for the next patient that comes in, if it's a new patient, to take those sequence of pictures again. And it just becomes this, protocol and routine that they follow that simplifies things.
So one question, a couple questions on that. So what if we're dealing with raw images? Most of the time you're getting a processed image from the SLR, but if you're doing anything cosmetics for submitting to journals or whatnot, you have to keep a copy of the raw image as well. Does this software handle that, or would it have to be something that I would just have to put in my own file directory system?
Yeah, I mean, that's where, if you are using it for AACD or whatever, and you need to have those original images, that's where we would just remove that little check mark on automatically erase. And then that will, pretty much, what case you're going to be preparing for that, right? I mean,
yeah.
You're going to work on that case so many times. You're going to take so many pictures, and you're going to, it's kind of retarded that what they make you go through, but you're gonna be prepared to save those original files, because you're gonna be working on that over and over and over and over, and those wax ups and those wax ups. And so, I mean, you're gonna want it to be perfect, right? So
this system works awesome. You said you have one, you usually designate one computer is the way you do it. Is there a way to set it up like, if every operatory had a card reader, if they're in there, that on one station you click that button, and on that computer it would know to go to that card reader. If you went to a different station, it would know to go to a different card reader, because it would be on that same station.
Yeah. The way that the software works is it's programmed per station, and you can tweak it per station, and you can have different layouts per station. So it's very, very versatile. So what happens is, on that station, as soon as you import and you go to point wherever you're going to point, that's the last place that it points is what it's going to remember. So if you do each station like that, unless they import and do something else where they're importing it elsewhere, then the software will always go back to the original pointing spot. So if you do think of it like a franchise mentality where you're trying to set up this protocol in every room, which is how you should do it, it will be like that in every op. So they'll get that sequence down, take the picture, take the card out, put it in the reader, hit import, it'll go and read that reader right away. And then every room will be set up like that. And then you're laughing. It'll be exactly the same thing on every station. And then you're flying, you're flying. Yeah.
I'm assuming that when you set one station up how you want it, you have everything preferences. You can just copy that preference file over to any other operatory to keep them the same.
Exactly. You can save, and when we install, that's part of it. There's ways that we can just apply to all stations, so we can do that. Yeah.
Sorry, I'm interrupting. One more question on the when you save the data. I noticed that window pops up and says, save all, delete all, and you delete that one time. But so on the software I'm using right now, when you're grabbing a picture, it's going directly onto the server. And let's say something crashes in the middle of that. Those images I've never had one lost yet. If you have the computer crash before you hit that save button, is it already on the server, or is it kind of just living on the computer at that moment?
It's in a temp file. So
okay.
when you acquire the images in the acquisition mode, it's going to be held in a temp file. And when we do hit that save all, it associates the images to that one patient. So there is a way to recoup and find the images. If everything does crash, they should be in the temp file.
Okay.
So yeah, good. So all great questions. Don't be shy to ask them. They're amazing. So it's good.
I've got more questions, but I'll let you keep going.
Yeah, please, not a problem. So once you get the images there, that's where you can just double click any of the pictures. It goes up into the viewport, and then any of the images that are up here, you just double click and it'll go full screen. And then you always have the tools at your disposal through the mouse. So your mouse, if you left mouse click, you'll always be able to control brightness and contrast. And then your right mouse allows you to kind of have a zoom. And then if you use the wheel, you can zoom in and out kind of thing. So that's, anywhere on any image that's active. And then you can go through, there's some arrows, there's big arrows and there's small arrows. So the big arrows will take you through the sequence of the exams that you just had. So, if you're doing an FMX, it'll go through all the tooth numbers in sequence. And then you have the up and down arrows, which will allow you again to look at multiple images of the same tooth. So if you did want to look at the historical, bite wings full screen, one after the other, you could do that here as well. In this case, this is where you're doing sort of a slideshow with the patient. So if you wanted to look through, or even for a diagnostic review of the images full screen, you can do that and look through them all and just kind of click through them. And then anything that you wanted to, document, save, show the patient, whatever, that's where you could do it and have the anatomy on file, and this is where you can, always zoom in, you can look at things. And anytime you want to go back to the screen, you just double click quickly and you're back to where you were before. So you always have that ability to blow things up and look at things and then have the full screen viewing. And again, any of the images where you have the plus sign next to the tooth number, again, you click, you just left mouse hold for a couple seconds, and all the images will tile out to view the history of the images taken there. And if you leave your mouse on it, it tells you the date and time that the image was taken. So that's how we've kind of integrated the SLR camera into the system and automated that. We even have a recording, if you wanted to record through the intro camera, or if you wanted to integrate a microscope and start using a microscope and recording for whatever reason, or taking pictures from a recording, you can do that through the software as well.
Recording, I'm sorry, interrupting again. Can you grab freeze frames out of a video with this software?
Yep. So awesome. when we launch the camera, let's just see. Through Zoom, I'm not sure if this is going to work too well. Let me just see, because sometimes it needs to have the speed device set up. Let me see if I can set up my camera to do this.
sometimes you'll have a patient where you're trying to catch that natural smile line. And it's tough to get in a static pose. When you get a video and get them laughing, you can catch a freeze frame of that.
Yeah, yeah. Well, that's exactly what we do here. I'm just trying to see if I can configure the intro camera to, sometimes I can do it, or maybe my,
It's as long as it can. I mean, we can figure it out.
yeah.
That's
I'm just
awesome.
trying to see if I can, it's not gonna work because I'm going through the web, so it's not gonna work. But yeah, so what happens is you'll just record here and then it'll show you here, like it'll play. And then when you want to grab the image or whatever it is, you just hit grab here. And then the picture will show up here and it'll start to save the images. So you can splice out of the video and you can pause. And then if you really like that image, then you just grab and it sections out those images. So that's where you could probably achieve what you're talking about with the smile line. Yeah, so that's a feature. We have also with, like, when you're going to the x-rays, let's get an original image here. Let's see, an original PA. So something like this. So we have like annotations and measurements. So when you open up this tool, the first tab is annotation and measure. So if you go to annotations, you can have any of the x-rays that have like a green bar on them, means that there's an annotation on them. So if you click on that icon with annotations, it will show whatever you've put on those images. If the icon is not active, it'll hide them for security purposes. But so I'll just delete them. But if you wanted to put anything on here, you just click on the tool and then you just drag and open whatever you want to drag. You can change the color of it. If you click on it, it'll allow you to, whoop, double click there by mistake. If you just click on the tool, it should activate it. And then you can change the color of it. You can change the size of it if you want it to be bigger.
Bigger, yeah.
And click and make it more robust. You can put an arrow if you want to put an arrow, and all kinds of stuff. So you can type text if you want to type text. You can type text. You can put a sticky note if you want to really make something very, very obvious and see it, like a big sticky note on there. So you can do all that. If you wanted to do implants, are you into implants, Dr. Gardner?
Working that way.
Okay.
Right now I'm restoring them, but
okay,
that's what we're planning for future.
Okay. Well, we have an implant stenciling solution in here. So let's say you're using Nobel and you want to know kind of what size of an implant you need. You can insert it, and what image is not calibrated. Okay, let's try it.
I was going to ask you, how you calibrate these so you can know the right size?
Yeah, it's they're automatically calibrated when we take the image in the software with the sensor. We program the software to calibrate the actual chip in the sensor. So it knows the size of the internal chip. So even if it's elongated or foreshortened, it actually knows the length of that distance, and it will calibrate perfectly for that. In the past, we used to take x-rays with like little ball bearings in the mouth and put little pieces of metal on the sensor and on the plates. Nowadays it's advanced, so now it's all fully calibrated.
I've never heard of that, actually. So let's say you took an off axis, you said it's elongated, or you've got something where you didn't put the sensor right next to the tooth, and so you got a different magnification. It can pick that up somehow? Yeah,
it does. Yeah, because it knows whenever you have a known length on the sensor, that's where you always have to calibrate it. So before, let's say if you were trying to measure something and you were worried about elongation and foreshortening, they used to tell you, okay, pop in a file that you know is 10 millimeters with a stopper, and then you'd measure that and you put in 10 millimeters, and then you'd be able to measure on that x-ray. It would be calibrated for the distance. But now, because they do know the dimensions of the sensor chip, they know that length. So they program that in. So when you take the x-ray, they know the length of the sensor is this. So if it tilts and it looks elongated, it's almost like you have that 20 millimeter setting already in there that's calibrating for this magnification. So the 20 millimeter is going to look 25 millimeter because of the elongation, but it's already knows that that's 20 millimeters. So it's automatically calibrated. So it saves you, and all measurements Like these, unfortunately, my demos are all like a whole bunch of images that I've had over the last 25 years that I've kind of imported and used and kind of mixed. So some of them are original images and some of them are not, and some of them are calibrated and some of them are not. So I just got to,
Can you find one? I'd like to see what this, there we go. I want to see what that looked like.
yeah, you see, that's not calibrated. So it's, that's the
Yeah,
problem.
it's just bigger than it needs to be,
Yeah.
but you could just resize that if you and drag it wherever you felt like.
Yeah. You see, there you go. That's a little bit better. So I would pick a smaller one. So obviously you pick something like this. So I would remove this one, delete it, pick a, you know, obviously that's too big, and then insert that. And then when you did that, you can move it, you could rotate it. Oh, grab the corner. Come here. You can rotate it around, put it in the right angulation, and know, like, based on this, what size of an implant you're going to need to place in terms of the abutments and depth to the nerve and stuff like that. And that's where you also have like that measurement. So if you go to the measure tab here, you go to the polyline and you can measure from the crown and kind of down the you know, the canal right to where you think the apices is, even though it's a 2D, you don't know if it's curving backwards or whatever, but you double click and then you'll kind of have a length that you can kind of work with there. So those are some of the things that we have in the system that allow you to, you know, you could take on endo, you know, you're doing endo or you're doing implant. This is where you can do your measurements and quickly figure out the working length and stuff. So we have that feature in the system. And then we have, like always, we have filtering. So you have that all filter tool that I showed you. And then you also have the individual filters. So again, any of the diagonal lines in the bottom of the app, if you just left mouse click and hold. So all of those filters that you saw open up in the all filter basically are all individually here. So if you know there's one that you really like, that's where you can choose it and basically click on it. And then it will treat the image with those filters if you like those filters. So just to give you an example, if I get an image up that maybe be, let's say, a before and an after. So here's two images. This has been obviously tweaked and saved. So whenever you see a yellow tab, okay, there's three colors. There's red, which means the original image taken in the software. So it's a DICOM compliant image. It is, you know, legal. You have green, which means there's annotations on the image. And you have yellow, which means that it's been altered and saved, okay? But you can always revert back to the original by just clicking on the two arrows that kind of in a circular fashion. So here's your original image that was taken. And you can then you can play a little bit with your contrast and brightness. But if you wanted to use the filter, that's where you can click on it once, twice, 3 times, 4 times. So you can kind of see now, you know, that interproximal decay is a little bit more visible now than in this one. The dentoenamel junction is quite a bit more apparent. You know, you could see the periodontal ligament there is a little bit, you know, sharper. You can see the apex on that tooth on the both roots becomes a little bit more visible. You can really see the artery and all that kind of stuff, and the bone level becomes a little bit more, you know, porous in appearance. So that's where those little filters help you diagnostically to see things. And then, you know, to explain to patients, you can always flip it to a positive, you know, which will allow you to explain a little bit better in the way people will understand teeth, where a canal is empty and the restoration is dark. And then they kind of understand this a little bit better than a negative. So it allows you to, you know, talk to them a little bit on a level that they'll understand.
Assuming the filters can be kind of pre-saved, so when they're coming in, you can have certain type of images that we apply the same filter to it as part of the setup process, as a standardized thing.
Yeah, we can actually program it to treat it right away automatically if you like a certain filter. It's just we found that sometimes based on, you know, the X-ray head, the positioning of the X-ray head, you know, the variety of X-ray heads and the variety within a practice, even though there are 3 of the same manufacturing X-ray heads, they have differing X-ray exposures, believe it or not. You know, like some of them are more precise, or the MA and the KVP, even though it's exactly the same, we've seen a wide variety of results. And even we've tweaked in certain ops. You know, you might say that on this op, I'm going to expose at, you know, 0.14. And on this op, I have to do it at 0.16 because this X-ray head's not quite the same. So, you know, sometimes when we apply these filters automatically, you do get a little bit of variety in the images. So that's why we still keep it kind of external, and that you can just click it if you want to see how it treats the image. But we can program it to be automated if you'd like. So we do that in the setup. So that's something that the text can also help you with.
Awesome.
And then that's where there's even like a button here that I'll show you, which are all the individual filters that we use when we're creating these different types of program filters.
Yep.
So when you look at an image like this, if I just take, you know, 3 or 4 of these features and I click on it, so you'll see how the image will change just by clicking on it. So you see how that quickly changed. And then I can say, okay, I'm going to put that, then I'm going to put, you know, a sharpen, then I'm going to put a gamma correction, then I'm going to put a stretch intensity, then I'm going to do a little Gaussian blur. So we do like 6 or 7 or 8 different things to achieve one filter, and then we program that into the software.
Perfect.
And then this is where, you know, we can really tweak each type of technology, be it, you know, this is where when we sold Dexis, we were able to get better images in our software than Dexis did in their software, because they just had one filter, a clear view, and it was always the same thing that would treat regardless of the X-ray heads. But this really allows us to tweak a little bit based on individual X-ray heads, and, you know, each sensor has its own little, you know, tweaking that might work better. So through experience, we've learned what works best, you know, and what we can program. But again, every dentist is different too. Some guys like the more washed out film look. Some people like the more aggressive Dexis look, you know, like that they were known for, like very grainy, very, you know, you could really see the detail a little bit better. But so that's where it becomes a little more customizable.
A little C in the bottom right-hand corner. Does that mean anything on the window? Yeah, right there. Like, does that mean
this was actually taken in a software that we have up here that we OEM, or that we made for a distributor up here. So it had a different name. So it had a stamp in it for the letter C, which was, it was for their name, the name of up here. Yeah. So you're not going to have that. This was really just it's more of a private label type thing. Yeah. Like, and even in Polaroid, they have like different colors too. So we've modified colors and stuff like that. So the one that you get might not be yellow. I think it's blue. So there'll be some slight changes, but not much.
Now, I know that we're only supposed to be till like 2 more minutes. I don't know how much time we have for your presentation or questions. So go ahead, but I don't want to interrupt you too much, but if there's any extra time, I've got a few questions at the end here.
Yeah, I got some extra time. I'm not really. I had.
Can I say something really quick? Or can you guys hear me?
Yeah.
Yeah. So Dr. Gardner, so the database right now, it's still converting. You have quite a bit of data. It's in right now 60%. So it should be done maybe like in the next hour or so.
Okay.
After that, we will continue with the hardware setup for the panel machine and the sensors and the bridge as well. As far as the training goes, I will be stepping out for like about an hour, and then I'll come back to you. Is that okay with you?
Oh yeah, absolutely.
Okay, for sure. So I'm still going to be monitoring the server. Like I said, it's about 60%, so it should be done like in an hour. And then around 12 p.m. my time, which is, I believe, either 3 p.m. your time. Yeah, I will come back to the call, and hopefully it's done by then, so we can set up the hardware and the sensors, and then the bridge as well for the practice management.
Oh, okay, I assumed that the Zoom call with I'm sorry, the gentleman who has been talking to the Robert.
Robert.
Yes.
Yeah.
For the hour.
Yeah. I booked an hour and 15, so we got some time, and I have till 2:30 pretty much here, so it's another half hour I could probably do, and not a problem.
Yeah, I'm just trying to give you an update as far as where we are with that, Dr. Gardner. So I'll step out of the Zoom meeting and then I'll get back to you about an hour.
Perfect. I'll see you then.
All right. Thank you guys. Thank you, Robert, very much.
Hey, my pleasure. Not a problem. Thank you.
Bye.
Okay, so you said you had some questions. Did you want to start with those, or?
Sure. Did you have more that you were going through?
Well, there's a couple other little features I could mention and I could show you. So I mean, there's it's minor stuff. So let's say for a pan, if you did have a pan up there, you can always segment out and crop out stuff of the pan. So
Awesome.
this ROI. So there's two tools. There's either you take out a square or you can freehand it. I usually use the square. So you can just kind of, if you wanted to just, whoops, sorry, let me activate it. If you just section out whatever, you could either section it out over top of this image, or you can click next to it and then just re-click on the icon and it will section out that section and you can save that as a new image. So if you had something that you wanted to, crop out, you could do that and save it as a new image. So that's another one of the icons. You have a magnification tool that allows you to magnify any of the images that are up here that are highlighted. You can magnify, and anywhere you move on it, it'll be magnified in the window. But you can also treat the image with some filters underneath. So you can put it on positive, negative, and then explore through a magnified view of the image. You can put it on histo equalize, which will kind of equalize the darks and the brights. So it kind of emphasizes darks and brights when you go on it. So if you really are looking at maybe decay or abscesses or something, it will accentuate the darkness a little bit. You have emboss, which is like a 3-dimensional perspective of density, which I'm still trying to learn about and figure out how this might help dentists. But maybe you might find something interesting about that. And then you have just histo equalize, which gamma equalize. So it just uniforms a little bit the exposure. So sometimes this helps with different views. So it's another way to magnify and look at things diagnostically if you want to. With most software, there's usually 50 things you'll never do, and that might be one of them, because you do have the typical magnify that everybody uses is the right mouse button and the zooming in and out. And if you want to use the filters, there are some filters that you can use aside from that window. You have, again, a simple print menu. So if you just click on that, you can choose how many pictures to just print on a piece of paper, 1, 2, 3, 6.
Awesome.
You can print with annotations. You can add notes underneath the pictures. You can choose pictures from your variety of different mounts that you've created. So you can take the intro camera and double click a picture for maybe the insurance company. Then you can go and put the X-ray on there right next to it and do that. And then the more you click, it'll just open up a second page and you can keep going. You can print multiple copies, one for the patient, one for you, one for the insurance. So that's where it's a very simple print option. And that's pretty much that. You can also just email any image you'd like, either two ways. You can right click and there's an email option, send by email, or you just click on the envelope and it will automatically open up an email with the image and you just whip it off. So you could do that. It will be in a JPEG format. If you did want to export the image, there is an export feature here with it's the same as the import one, but the arrow out. When you have the export, what's good is you can export the image in different formats here, and you can even test the size of it. So if it's too large, you can estimate the size of the images that you're putting in. So if
Hold on, just gonna try and deliver a package in 2 seconds here.
Yeah, go ahead.
Great info, Robert. Thank you.
No, my pleasure. I mean, you can see that he knows a little bit and it's good. Lots of good questions.
Yep, I think he'd be a great referral for us once it gets rolling.
Yeah.
I'm excited about this.
Yeah, so you can import and export. Even when you import images, let's say you do get somebody that brings like images digitally, X-ray, whatever. When you import the images, you can choose the format as well to being a grayscale type image. So where is that? If we, oh no, sorry, it's not the import picture directory. It's import. Let me just move this around here. Put that back up. Let's just cancel out there. So there's a couple ways that you can import images. You could either import like a directory like you did with the digital camera, or you can just do one.
I'm assuming you can do like a DICOM too if we need to do something like that.
Correct. So you can bring it in as a DICOM, and you can also bring it in as a grayscale. So you can utilize all of the tools for X-ray, which is it needs to be a grayscale image in order to take all these filtering and all these tools that you want to use. So you just have to make sure when you're importing like the pans or the X-rays that you're doing it with the grayscale feature. So there's a couple of ways you can access tools. There's this button toolbar, but also from the file, you have some of the same I guess tools that you can activate. So you have like the acquire the X-rays and stuff like that. You can, but if you do file import picture, that's where when you do that, you can choose here either 16-bit or 24. You can keep the date or add the date that you imported it in. So you can keep the original date if you wanted. If it is a DICOM, you can import movies and video if you needed to.
What is the XIF date time? Is that custom? You can put your own date on there.
You can do your own date time. You can use custom date time here and put it in. So you can customize it or keep the original image based on the legal needs. And the same when you're doing the export. When you export just a picture, that's where here, when you click down, you can export with 4 different type of DICOM formats.
Perfect.
So if you wanted to have it lossless or compressed or whatever, depending on the size of the image, you could do that and still keep all the original information and the legal information when you're sending it.
Awesome.
And then we have full mount screen. So any of the mounts, if you ever want to see them full screen, you can just click on this icon and it will blow them up full screen. This is kind of like the old school days when we had the light box and you had the full mount series on there and you had the magnifying glass, or you're wearing your loops and you're looking at the X-rays. But basically anywhere you go here, you can kind of look at them all, full screen. Also for ortho, or even for the SLR, this might be cool. What I'll show you is for ortho, what we did was kind of cool, or even for the SLR images. Let me see this one. Okay. So if you do the full mount screen there, so how, are you using mirrors and retractors and stuff?
Yes.
Okay. So a lot of time is wasted trying to frame sometimes the pictures and trying to get the right distancing and trying not to see all the, mirrors and retractors. And some people waste a lot of time doing that. So what we did here is when you have you just tell your staff, don't worry about it, because we're going to crop and fix them once they're in the mount. So what you do here is you just click on the picture. If you use the mouse, you can make it a little bigger. And if you use the right mouse, you can drag and center. So you can kind of forget about being so picky, needy with all the accessories. You just click, zoom it up, center, zoom it up, center, and then you don't have to worry about all the peripheral stuff that you worry about when taking the pictures. So to expedite the picture taking, you can just quickly tweak it, crop it, center it here, and then you can save it in the format that you'd like. So you could do this also for, those digital camera shots if you're, a little bit.
You can't rotate them though. You can just kind of move them and magnify them.
Correct. The rotating actually is programmed when you're going to download them. You can anatomically position them the way you want. And that's where you should be training your staff.
They should be doing it straight on.
Let's do that full face. Let's do the, the smile with lips. Let's now do the retraction. And if you do take one for lengthwise purposes or whatever, in the computer, you can program that box to flip it a certain way. And you can program all that so that when they do download it, everything gets put in the right orientation. And then boom, if you just wanted to remove some of the periphery here, if you're taken with the mirrors and there's something you just don't like to see, the retractors here or whatever, that's where you just would zoom it up and kind of make it put a little bit more centered like that. So then it looks more professional type of thing.
Sometimes you get that one assistant that never since get the horizon exactly level. Like, it's just askew slightly. Like,
Yeah.
well, I have to, anyway, that's perfect.
Yeah. Well, there is a way, actually, I'll show you that. So no, I won't save changes, but if you did get an image like that, you double click, there is this rotation,
Yeah.
which we have, 90-degree, but the second button is freehand rotate.
Oh, perfect.
So this is where now you can kind of just do this type of thing. And you can kind
Yeah. Just, okay. So it's not, and it looks like you can go degree by degree. So it can even be less.
you can do it just one by one if you really wanted subtle little changes. So
and then you crop it on the mount if you felt to do so. Yeah, that's great.
yeah, once you get the angle, then you would just save it and then it's done, and then you can crop out the other stuff later. So if you really wanted to get the right bow line there for your smile line or whatever, you could really navigate it perfectly. Yeah. So that's a feature too, a button that we have there. And that's pretty much it. I mean, that's, there's a little bit more, but not much. That's the majority of the options and tools. So you had other questions?
Yeah, a couple of questions. I hope I won't overwhelm you there. So, and I'm seeing these green and red boxes. I'm assuming that looks like the amount of pictures that are associated with the mount. That's what the green boxes are?
Exactly. So whenever you wanted, so a couple of the features up here, I'll just go through. So this is the mount window. At the top is that little activation, move forward or stop on one. That's always visible. It's just a programming element that is part of the acquisition. They leave it here. You have a delete. So anytime you want to delete an image, you can just drag and drop it to the trash. It's a little black trash can. You have the email that allows you to just whip off any image that you've highlighted that'll be in. You have the search, which is where it opens up the date search of all the images within that mount. And then the last one is you have the scheme, or I don't know why they named this scheme, but it's kind of the mount or the scheme. So you can, create a new scheme. You can, save changes to the scheme. You can rename a scheme. You can delete the scheme.
This is the whole screen. This is the mount or the way the screen's laid out?
No, this is actually the mount. They call it a scheme of mounts. So it's just the way that it's organized. So if you wanted a new scheme, you could choose, let's say you liked, I don't know, whichever one, the X-ray primary, let's say, and you wanted to, you could say, okay, new scheme. So you're going to name it something new. You go, okay. So there you go. It's going to use that template. You have that. Now you're right. If I want to add boxes, I just click here. And then I can move these boxes and add them anywhere.
Oh, perfect.
Into there, and I can line them up and I can put them any which way. And then when you go to, you can actually alter the way that the images, if I go to image properties and associations, you can change the way that these are in the system. So you can make them horizontal, you can make them vertical. Image associations is here. So when you look at this, you could either number them numerically, okay, meaning it'll be like 1, 2, 3, 4, 5, or, and this is where you would change the orientation. So right now it's in an upright orientation. If you wanted that image to come in on the side, you would just click a 90-degree turn. So now the image would automatically flip to the right. Yeah, so now any image that gets brought in this, it'll be turned sideways. And you can do it, mirror, you could flip it horizontally, mirror it vertically or horizontally. And if you wanted it by tooth number and landscape, so landscape allows you to change it from upright to landscape. And then if you click on the tooth here, now you can actually name it by teeth number.
Beautiful.
So now it'll be by tooth number. Now this is the Canadian tooth number. We have the American tooth number. So you can do it by that. And then if you save now, it'll save it by that tooth number and it'll save that sequence that way. So that's how you would modify and change a scheme or add a scheme. And then it would be there all the time. So now we have that one there. We go back to our other one and it's always going to remain there. And then if I don't want to keep that, see, I didn't save the changes. So we didn't save them. So always save changes. And then if you wanted to delete it, you could easily just go here, click and delete scheme. And then it's, are you sure? Yep. And then it's gone. So it's as simple as that to modify, add into the into your mount, let's say, or scheme as they call it here. But that's how you would modify and add and remove and customize.
So let's say I had a amount of X-rays. Maybe I know you were saying you had different setups for the screen for different doctors. I like how you got this with the 4 viewports up there, and then the mount on the bottom, and a library on the bottom right. If I wanted to show 2 mounts at one time, let's say I want to have like a mount of X-rays and a mount of like intraoral pictures. Can I have those 2 mounts show at the same time? You have to toggle between them.
Yeah, honestly, most people don't want to see like full mounts side by side. They would, that's why the way we designed it, you know, for space and for layout, we have them all, your mount is there, but it's really getting the individual images up out of them. So that's kind of, you know, how we designed it. So you can't really, I mean, you can always get, you know, that mount, full mount screen if you'd like, you know, you could do it that way. But it's 1 mount at a time. It's never like side by side. Most people, I think it's more the image specifically that they might want to look at side by side, not the whole mounts.
Let's see, if I were, one thing I had a question about was on like smile design. So you had those simulated pictures, you know, how you could, I know on the pro version, I think I bought, you can kind of distort things and kind of give us whiten things and get a simulation, put in some maybe library drop-ins. Is there a way to do, like, let's say I had a full face picture and I wanted to drop in like a simulated smile into that? Is that something the software can do? I know there's some of those softwares on the market, and is that something I'd have to do separately?
No, I'll have to follow up on that, because we did work with, in the States, there was a Hornbrook library that was designed and that we did have and that we started to use. The problem is that we didn't really sell a lot of it, because what happens is, your issue, Doc, is you're going to be presenting these people with this beautiful, perfect smile that you're not going to be able to achieve anatomically, because a lot of these perfect inserts. So let me see. I haven't used it in a long time. Let me see if I still have it.
You can put a little cutout region, and you could have a drop-in region.
Yeah.
So obviously, it's not it's a pure just stock library simulation, but I get what you're saying.
Yeah, I have it. I don't have it loaded here. Normally we have, this is your smile library. You would click here. You would have a whole bunch. You would double click on the type of smile. So they had a variety of different teeth shapes and stuff. And then it would open up this huge library of smiles. And then you would choose the one that you'd want to impose in the selected area. And then you would size it and ratio it based on the center lines and stuff. But honestly, people moved away from this because of the issue of not being able to deliver what they could do. So most people, when they look at this cosmetic simulation, they'll do minor cosmetics that I showed you for speed and for simplicity and for realistic possibilities. You know, that's what they have. But we do have, I could probably still get you the Hornbrook library and have it installed into the software, and then I could train you on it if you wanted to do that.
I think I'd like to see it. I do a lot of, I don't know if you're familiar with Spear. I know you mentioned LVI and
yeah, of course,
other ones, but so obviously, you know, when you design these things, there's a lot that goes into it, more than if you're doing, you know, aesthetically EFSB. I don't know if that's something you're familiar with, but this wouldn't replace that by any means. But as a getting a patient excited to say, you know, what's a quick thing what if my mouth looked differently, and you see just their whole picture with a different smile. I think there's some value to that. But
yeah, no, I agree. I think it has a huge impact psychologically when they see how that, you know, set of teeth will impact their overall look, and I think that's a huge seller. So, but it's just really, you
don't want to overpromise. I get that for sure. And you don't want an assistant start doing that, because they're gonna. It's got to have a doctor's eye of what can and can't be done.
Exactly, and that's where I think a lot of them got kind of in trouble. Let me just look at something here quickly. I just want to.
but it's something I'd be interested to play with for sure.
Yeah. Let me just see if I have.
Let's see what time we got. So, is this 3D compatible? I don't actually have a cone beam yet, but is
Yeah,
that something that you-
yeah. We interface with, I think, 5 3D systems now, and we're continually programming for the latest ones. And we even have there is a 3D viewer within the software that will allow you to kind of import images in and have a very limited use of a 3D aspect to use when showing patients some information, which I'll show you. Let me just see if the manual would have something.
Yeah, again, a lot of these things I'm assuming there's a text manual that I'll have access to, and I can just read the
Yeah.
documentation on.
Yeah, I'll just have to look and see if we can still
problem.
access that small library that we had. But
And the 3D viewer is actually an option.
yeah, the 3D viewer is an additional option that they have to purchase. Yeah.
Does that come with the, I mean, like I said, I don't need it yet, but purchasing the professional version, does that come with everything, or are there additional add-ins even to that? I thought there were just kind of 2 flavors, like the base level and then like.
Oh, there are options that are not included in the full version, which are there's a tablet module that allows you to utilize a tablet. That's not part of the base. I mean, the professional package. You have an ortho tracing element of the software. That's also not part of it. You have the Smile library, which is also not part of it.
Oh, I thought I did get that.
So there's some things that are additional to the packages, and I've provided I guess Bob with that. He has kind of what's part of the entry level, what's part of the full, and then there's only 3 or 4 additional things that you can add that are kind of like the 3D viewer. That is something that is an additional option. It's not part of the full, because what happens is the companies that came out with the 3D machines initially, they were charging a per station license, and they were charging an expensive per station license. So we decided to program a 3D viewer with limited capacity, because you know the software you have when you're doing your diagnostics and you're looking at all the treatments, I mean, it comes with that product, and you have the best software for that product. But when you just wanted to have a viewer, maybe like this one here, that's where you can just have very simplistic stuff to show certain elements to patients for educational purposes, like this here. So if you wanted to kind of show them something.
We're not trying to treatment plan the implant dropping in here, but we can discuss it and just look at it, what you got.
Yeah, so this is where the implant dropping, that would be probably more specific to the software that comes with the 3D cone beam. This is really if you were just doing some basic looking and showing and explaining, and it was a less expensive option to the more expensive licensing that was charged at the time, and that's why they came out with it. And they even have, like, you can do here your curved NPR type thing, where you just create the bow of the thing. You just will create the center of each tooth, and then you can kind of have the ability to view through the arch and communicate in the 3-dimensional realm. So that's where you can easily move things around and have the ability to kind of see things in the patient, and use these. It's a very limited version, but
No, that's fine.
yeah.
With the you're talking about the Smile library. That was something I was going to ask. I know we develop our own libraries. As I got pictures, I think that's fantastic. But there is a stock library is that what you're referring to? That could be not Hornbrook. Is that something different? Just kind of explain to me the difference.
Yeah, like here's an image of one that I did.
Yep.
So the lighting is a little bit off here, but here's like an example of a Smile that I slapped into this one when I had it. And the Hornbrook library was it's a library that was designed with Hornbrook and kind of designed, with a whole bunch of different smiles, and it gives you like, different shapes and these type of things. But you can import your own images into the Smile library. So
the Smile library comes with, if I like, comes with stock images, right? Some or none.
I don't think it has any unless you buy the Smile library element, which we didn't. Like I said, I don't have in my version now, and we really didn't sell that many, so we haven't had the demand. So I'd have to look into it to see if you wanted to have that, I could look into it and see if we could get that for you. But I know that there was a way to import images into the Smile library, your own images. So you could probably do that. But again, I haven't looked into that in a while, so I'll have to look into that. Yeah.
So it'd be interesting just to know, I don't know, just to have a sample and then find out what the pricing would be, and if it's something that it's worth it just to look at. I'd be curious. Let's see, I think. And then I know everything's kind of on dark mode there. That's default. I mean, I like it. It's fine. Is there a way to change the color scheme so it's like traditional white mode, or does that matter? I mean, is all?
There are some things, some colors you can change. There's some that you can't, but there is there's certain things that you can tweak. And in the setup, when they do more install and they're talking with the techs at our head office, they can guide and show you, like the background colors and stuff. You can make different colors and stuff, but there are certain limitations in certain areas. So, but they'll know more what that is. I'm not 100% on that kind of part of it. But.
Thank you so much, man. I appreciate it. I love that report thing. Looks fantastic. And there's just a lot of really smart stuff with the software, and done a great job presenting it. So thank you.
Well, thank you, man. I really appreciate your time. It's great dealing with people like you who are quite advanced and quite progressive. And this is where I think you're really going to get the most out of the software. And then once the team gets on it, I think you're going to really benefit from it, from just being able to communicate and show stuff to patients and get them to do what you need them to do, and that's the goal, right? Is you want to use the power of images to get them to see that need for treatment, see what you can offer them, and get them to do it, and then you spend your time doing the work. That's what you should be doing. So that's what we tried to do, is we designed the software really, not with any equipment, but to work with all equipment. But we really worked a lot with dentists on, what do you do day in, day out, and how can we make this really benefit you and your staff, and make it the right tool. So
I did have one question. So the camera I just purchased, the P31, it's a caries detector camera, and so they've got a system where you can take normal color picture, fluorescent caries detected picture, and a transillumination picture all in one. Seems really great. I was trying to figure out flow wise how to display that to patients, because you're going to get exploded with all types of pictures. It seemed like this Caddy software, maybe with that little dropout picture would be the best way to do that. You kind of have the same image of that same tooth. You can put them side by side up there pretty easy.
Yeah. So that's what you do, is you have that one picture that you've taken on that tooth. It might be like the transillumination, or the fluorescence, or just a regular shot to show decay. So it's underneath the same tooth number. So when you hit on it, it tiles out. All those three images are going to be side by side. And then if you double click them, they'll all go up high up on the screen side by side. So you can now discuss all three formats of that image and show them all the different information. So you could show them the fluorescence, maybe, promoting the plaque, or, the caries, or even for you, I think that's going to be great from a clinician point of view. When you're removing, the restorative materials, use that camera to make sure you've gotten all the material out, make sure that you've removed, or you've got all the caries, or you got all the, you can be more conservative a bit too, and you don't have to remove all tooth structure, as long as you get, but that's what the fluorescence I think is going to be great for. We sell microscopes also up here, and one of the microscopes we have has this fluorescence, and that's huge restorative. People love it for caries and for seeing the different materials. They fluoresce differently, so you really know where you stand between tooth structure and restorative materials. So it's great. And Caddy, like I said, the imaging, like I said, is going to allow you to see it historically. So that day you'll have all the images are right there. The first ones will be chronologically the ones that you just took, so you can easily show them what you're talking about. Yeah, it's a great camera that you got. I actually played with that camera when they got it and made sure that everything was configured properly. And it's a great camera. I liked it. I loved it. Yeah.
So and again, this is a technical question, but when I usually take a series, and I know we're about out of time, when we take a series of pictures here, normally it's going to go from one picture to the next picture to the next picture to the next. You would have to program it to do 3 on one shot before it advanced if you're going to use that type of mode. Is it
correct?
Ability?
Yes, that's why when you do start in the with the intro camera, you have that button. There's a button with a green button and a red button.
Yep.
So in the camera mode, it's automatically programmed to be on the red mode, so it will stay on the box. And that's where, you know, with my camera, I've got a button that advances it automatically. You can also, you know, with that camera, again, I believe they can program one of those buttons to be an advance and one can be a capture. But your worst case scenario is you can buy a foot pedal also. If that can't happen, you can always have a foot pedal that does the same thing. So, because most of the time you do want to take,
yeah, I think it would work.
Yeah, most of the time you do want to take multiple shots on that tooth, because the transillumination, there's going to be certain angles that will show fracture. It will show, you know, the carie. It will show, you know, distally, interproximally, buccally. So you're always taking multiple shots just to give that patient that perspective where they can see it from all different angles. And so that's what you do, and that's the way it's designed. But you want to make it so that the staff can get those pictures in underneath the tooth number, not have to go in after and play and like label and save all that time. So yeah, so this is why it's a great feature. And then you advance, and you only document. It depends on the office too. Some guys take pictures of every single tooth, which I find a little bit. If you're using a digital camera, you get the anatomy, you know, the arch, the quads, whatever. You have that point of reference always, you know, documented. And then the intro camera is really, what are the concerns in the mouth? Let's get those shots of those areas that we want to focus on. What's the strategy? What's the treatment plan? What are we going to be doing? And then let's talk with the patient and set up that plan, and let's look at the scheduling and what can be done and what's their budget and all that kind of stuff that comes into play. But, you know, you're going to be taking maybe 15, 20, 30 images max. You're not going to take pictures on every single tooth. That's way too much.
Well, anyway, I know what you're saying. It's crazy. But thank you so much. It's been, this is night and day better. I don't know if you're familiar with some of the other softwares, but I don't want to mention, I mean, maybe I should, but man.
Oh, I know them. I know them. Trust me, I know them.
It's been, I've been pulling my hair out with it. So this is going to solve a lot of problems for me. So thank you.
Yeah, no, great. I'd love to hear that, because I mean, look, we've been doing this for a long time. We've really refined the product. And, you know, I think Polaroid is going to do an amazing job, you know, and I think, you know, I'm here to help them out and definitely get them up and running. And so please, you know, create that list of questions, you know, we'll get you going, and then we'll be able to answer them and do the next training and make sure that you're using it to its full potential. And then I think you really enjoy it.
Awesome. Thank you, sir. Appreciate it.
My pleasure. Thank you. All the best. So let's talk soon. I'll talk to Bob and we'll get in contact and we'll try to set up the next meeting. Okay.
Yeah. It may be, I'll train all the staff. I know we were talking about a week later, but honestly, this is a lot to go through. We might push it off maybe 2 weeks just to let them play with it a little bit longer and we work out some of our systems. Yeah.
Create that central list of questions. Everybody can write it there, and then we'll review that in the second session, and then we can go into a little bit deeper on the customization and stuff too.
Yep. Thank you.
Yeah. Thank you, Dr. Gardner. Great meeting you. Okay. Thanks, everybody. Have a great day. Have a great weekend.
Bye.
Thanks,
Bye.
Dr. Gardner. Beautiful job, Robert.
Thank you very much. Appreciate that.